Okay, so in this video we're going to look at chapter 20 on the lymphatic system. And this is a nice kind of segue from our discussion of blood, right? Because we learned about how blood is mostly plasma and plasma is mostly water. Now, what's interesting too is that the blood vessels of your body are typically pretty leaky. Like the capillaries of your body are pretty leaky. So that means you can leak this fluid into your tissues. And if you didn't have a way to remove that fluid that leaks out of your blood into your tissues, you get a lot of swelling or edema, right? A lot of fluid accumulation in your tissues. So what our bodies have is a way to kind of compensate for this is a series of vessels called lymphatic vessels. And what these do is they pick up the excess fluid that leaks from your tissues and they carry this back towards the bloodstream. But what's interesting about the lymphatic system too is that it has a pretty good immune response associated with that as well. So as this fluid is picked up from the tissues and carried back towards your bloodstream through a series of special vessels, it's also cleaned up along the way. And it's cleaned up because not only do we have this lymphatic vessels that pick up that fluid, we have lymph nodes, which basically cleanse that lymph. Okay? So lymph is that fluid we were talking about. Okay? So what happens, you guys, is that remember all this fluid that leaks out of your blood vessels each day. It ends up being about 1.5 to 3 liters, which is quite a bit. Because if y'all remember, a normal blood volume is about 5 liters or so. So this coffee cup is maybe 800 mils. So you're saying about 7 of these you only have in blood, right? There's not a whole lot of blood in your body, only 7 of these things. And you're saying about 4 to 5 of these leak out of your bloodstream into your tissues each day. That's a lot of fluid, right? And so that fluid that leaks out of your blood plasma into the tissues, we call that interstitial fluid at that point. So if it used to be in blood, but it leaked out and it's now into tissue, we don't call it plasma when it's in the tissue. We call that interstitial fluid. So in the tissue fluid, right? And so interstitial fluid, if you don't remove that, it just builds up and you can lead to swelling or edema. And so what happens is your lymphatic vessels can pick up this excess fluid and it returns this interstitial fluid back into blood. But what happens is that when lymphatic vessels pick up that interstitial fluid, we don't call it interstitial fluid anymore, we call it lymph. Okay? So you go from blood plasma, leaks out of blood vessels, then it's interstitial fluid. If the lymphatic vessels pick up that excess fluid and it's now in the lymphatic vessel, we call it lymph. Okay? It's really just the same fluid, it just depends, it has a different name for where it is, right? So for instance, like, you know, when you step foot into this place, you guys are students. But when you go step foot into another place, you're not considered a student necessarily. You're considered something else. Like you go by a different name. Like you might go by, you know, CNA or, you know, wherever your place of work is. You know, so you kind of change names even though they're the same thing, right? The same person. Same thing with this fluid, right? So blood plasma when it's in blood, interstitial fluid when it's in the tissue, and then it's lymph when it's in a lymphatic vessel. But it's all the same fluid, just continuous. Now, once this interstitial fluid enters the lymphatics, we call it lymph, and it's about 3 liters a day. That's a tremendous amount of fluid, you guys. So this is my 1 liter water bottle, you guys. So 3 of these are returned back into your blood every day from your tissues. So you can imagine that if there's a problem with your lymphatic system, this fluid's going to build up pretty quickly in your tissues. So what this looks like, kind of look at this process here. Let's actually start down here. So if you look closely, this is actually in the tissue here. And this green thing is a lymphatic capillary, right? And the lymphatic capillaries are a single layer of cells, and these cells kind of overlap here, right? Now, by overlapping, they can form a valve. So what happens is that excess fluid or interstitial fluid can get pushed into the lymphatic capillary through that valve, but the valve acts as a one-way valve, right? So this kind of opens up so you can push fluid in, but the fluid won't leave once it's in there, right? So what's the fluid called if it's in the tissue right here? Interstitial fluid. And then what's it called if it gets pushed into the lymphatic vessel? Lymph. It's the same fluid, just, you know, it's in different areas then, okay? Now what happens then, you guys, is that these lymphatic capillaries start to come together and they converge. And you can see they're all throughout the tissue. In fact, they're even kind of intertwined with the blood capillaries. And so that the lymphatic capillaries can pick up that excess fluid and eventually start to carry it back towards the bloodstream. But what's interesting is along the way, we have these little lymph nodes. And the lymph nodes essentially help to cleanse this lymph as it's carried back in the blood. So if you find any debris in this fluid or bacteria or viruses or anything that needs to be removed. The immune cells that you find in your lymph nodes can kind of cleanse that and remove that as it moves back into the bloodstream. So what's interesting then is that if the lymph is kind of dirty when it's first picked up, right, there's a lot of maybe debris or microorganisms if there's an infection present, is that it should be cleaned up as it moves along the lymphatic pathway back towards the heart, right? So by the time the lymph gets back towards the bloodstream, it's pretty clean then. But then when lymph enters the blood again, what do we call that fluid? So if it had been lymph when it's in the lymph vessel, and then that fluid goes into blood, what do we call the watery part of blood? Plasma, exactly. So then now we call it blood plasma again. It was lymph, but once it goes back into blood, it's blood plasma. So the whole thing goes full circle. So if you guys look here, here's the circle, right? Is your heart pumps that blood throughout your body, it gets to your blood capillaries, fluid leaks out, lymphatic vessels pick up that excess fluid, and that excess fluid in the tissue we call interstitial fluid, right? When it's in lymph, we call it lymphatic fluid, or lymph. And then it's carried back into the bloodstream, and it's plasma again. So it all goes full circle, as you guys can see here. So it's part of your circulatory system. It doesn't carry blood. It carries lymph, which is the leaked fluid you find in your tissues. So it's kind of interesting. So what we find, you guys, is this process of fluid flow occurs in one direction. And the reason why it allows for unidirectional flow, or a one-way system here, is there are one-way valves in these vessels that prevent backflow, okay? So as the fluid moves into the next area, a valve can kind of close behind it, and it can't go back to where it came from. It can only move in one direction because of those valves. And if you guys noticed in the last slide, we saw here that the end of the lymphatic capillary is a closed-end tube. So it's not like it's a hole where the fluid can leak back out. So once that fluid enters this lymphatic vessel, or capillary here, and it starts to get drawn up back towards the heart, there's little one-way valves that prevent its backflow, okay? Now these collecting lymphatic vessels are a little larger, and that's when lymphatic capillaries come together, and these collecting lymphatic vessels would be all throughout like an organ or a tissue, okay? And then when they start to converge, then we form trunks. Now the lymphatic trunks drain like entire regions. So for instance, the right subclavian trunk drains your whole right upper appendage. Or the right jugular trunk drains the entire side of your right face and neck, okay? Or the right lumbar trunk drains the entire lower appendage, right, the right side. Or the left lumbar trunk drains the entire left lower appendage as well. So the trunks are larger lymphatic structures that drain entire regions. Now when the trunks come together, they form ducts. It's not on the slide, but there's only two ducts. There's only two lymphatic ducts in the body, and I'll point these out to you guys here in a minute, okay? So if we kind of look at the system here again, you guys, up close. Here's the lymphatic capillary. You got overlapping cells, and that allows for, basically allows for fluid to get forced into this capillary, and it can pick that up and help transport that back towards the bloodstream. And so there are some other types of specialized lymphatic vessels too in the body, like we have lymph capillaries. And so you find these in bones, teeth, and bone marrow, right? I'm sorry, I'm just kidding. Lymph capillaries are absent in bone, teeth, and bone marrow. However, you find them in pretty much every single other tissue of your body. Now this slide says they're absent from the CNS. That's actually only kind of true, because there was a new system discovered more recently. It's called the glymphatic system, and it's a series of drainage of this kind of fluid, but it uses its own special vessels that were recently discovered, like about 3 years ago. And so it's not in our book yet, but it's kind of interesting to note. So as far as we're concerned, you guys, just think of lymph being absent from bones, teeth, and bone marrow, but your central nervous system does have some lymph drainage. It's just that our textbook hasn't caught up with the new research. So it will, though. That's when they have like a new edition. You have to change the and which is weird because usually they don't like discover a whole lot of new things about the human body. They kind of think like, oh, we know what we know, right? But this is one of those things like, okay, we actually have a new discovery, and we have to include a whole new system of lymph drainage in the central nervous system. So it's really interesting. All right, guys. So the lacteals, though, are ones that we've actually talked about before, and these are the ones that you find in the small intestine, and they drain lymph from the small intestine, but they also pick up fatty lymph there as well, which we call chyle. So if y'all remember, the lipids that are absorbed across your digestive tract are absorbed into lymph, not blood. And so your lymphatic system also serves the function of transporting lipids back towards the bloodstream from your digestive tract as well. Because it's not absorbed straight into blood, lipids are absorbed straight into lymph by these specialized vessels called lacteals. And so these collecting vessels, what we find, you guys, have thinner walls. They're pretty similar to veins. They anastomose, and they can travel alongside veins. Now, the deep vessels here travel by arteries. And what's also kind of interesting too, guys, is that some of our lymphatic vessels are so big that they have to have their own blood vessels in the wall of the lymphatic vessel to supply it with adequate nutrients. And we call that vasa vasorum. So the vasa vasorum are blood vessels in the wall of your larger lymphatics, right? Because those things have so much tissue that they have to actually have their own blood flow in the wall of the lymphatic vessel itself, which is kind of weird. So what this slide here shows you guys is basically lymph drainage throughout the body. And if you all look closely here, you can see it's kind of color-coded, right? So all of this in light green are all of the body regions that are drained ultimately by something called the right lymphatic duct. Do you guys see this right here? So the right lymphatic duct is right here, and it drains everything that's shaded in green right there, okay? Now, the place where right lymphatic duct drains is right at the juncture of the right jugular vein and the right subclavian vein. So right at that juncture, the right lymphatic duct drains that fluid back into the bloodstream, okay? But then you might wonder, okay, well, where does right lymphatic duct get its lymph from, right? Well, it receives lymph from the right jugular trunk and the right subclavian trunk. So if y'all remember, the right jugular trunk receives lymph from the right side of your face and neck, and the right subclavian trunk receives lymph from the whole right upper appendage, as well as the skin of the anterior and posterior thorax. Now, we also have something called a bronchiomediastinal trunk, which you can kind of see right here, you guys. It's not labeled on this slide, but the bronchiomediastinal trunk drains lymph from the right thoracic cavity. So you're saying that lymph from the right lung is also drained into the right lymphatic duct. And so that's everything that's shaded in green here, right? But what if you had a tumor that blocked that right lymphatic duct? What do you guys think would happen if you blocked the drainage of the right lymphatic duct? Yeah, you have a buildup of fluid. And where would that fluid build up? The right arm, right upper appendage, the right side of your face and neck, and the right upper thorax. Isn't that weird? So fluid would just back up there. So someone could have swelling just on one side of the face because just this right side of the face, its lymphatics are drained by the right jugular trunk, okay? And so if the right lymphatic duct is blocked, it's all going to back up to where it came from. So it's kind of interesting. And I've seen this before, actually, guys, where someone actually had too many lymph nodes removed from their neck, and they had really poor drainage then as a result, and they had permanently swollen lips, and they were only swollen on one side. So like they actually had swelling of their lips just on the right side of their face, and they had normal size on the left side, and you can kind of tell. You know, it wasn't really prominent, but if you look closer, okay, you can see the difference, which was interesting. Yeah. And then you guys see everything that's kind of in reddish, pinkish here. That's all the body regions that are drained by what's called the thoracic duct. Okay. So the thoracic duct is what drains right here, and it actually drains lymph right at the juncture of the left jugular vein and the left subclavian vein. So what the thoracic duct receives lymph from is the left jugular trunk, the left subclavian trunk, the left bronchiomediastinal trunk, and if you follow thoracic duct down, in fact, all of this is thoracic duct. We can go down, 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 down. It starts at something called the cisterna chyli, and cisterna chyli receives its lymph from both right and left lumbar trunks. So we're saying that the thoracic duct drains both lower appendages, your pelvic cavity, the entirety of your abdominal cavity, as well as the right thorax, the left thorax, the left upper appendage, and the left side of your face and neck. All that's drained by the thoracic duct. I know this is kind of weird, you guys, because a lot of times when we talk about anatomy, we think about symmetry, right? Like things are equal on both sides. With the lymphatic system, that's not the case. You don't have equal right and left drainage for the lymphatic system. There's there's kind of asymmetry of the anatomy here, because we're saying that the thoracic duct drains things from both the left and the right sides, whereas the right lymphatic duct drains things from only the right side and not the left, but it doesn't do the entirety of the right side, because the thoracic duct drains lymph from the right lower appendage and the right side of your abdominal cavity. So it's kind of interesting. Okay, so if we zoom in on this and kind of get a better idea of the anatomy here, what we're looking at is a posterior thoracic wall, right? They've removed the lungs, they removed the heart, the esophagus, the aorta, vena cava, and all that. So what's left then is basically your ribs, intercostal muscle, but what we really care to talk about here, you guys, is the green stuff, the lymphatic vessels, right? Now, they wouldn't really appear green in the body. They actually are more clear because the vessel walls are so thin that you typically don't really see these that well in dissection. But to make them look distinct, they just kind of show them as being green on these drawings, right? And so we want to talk about cisterna chyli first. And cisterna chyli, if you think about the name, cisterna chyli, right? Well, we already talked about chyle. What was chyle before? It's fatty lymph. Good, exactly. So do you guys know what a cistern is, though? It's a storage site of something, right? So like you have like a cistern of water. You know, they have this on farms. Like if you want to store a lot of water on your farm, you'd have like a big old cistern to store thousands of gallons of water, right? And so cisterna chyli is basically a cistern of chyle, right? So we're saying that this would actually receive the fatty lymph from your abdominal organs, okay? Now it's located just inferior to the respiratory diaphragm, which means that it's under the influence of those volume and pressure changes we talked about with airflow in the respiratory system. So if you're talking about how you expand your thoracic cage during inhalation and that increases the volume, well, guess what? Cisterna chyli actually experiences those changes in pressure that occur with your respiratory system. And so one of the functions of cisterna chyli is that it actually serves as a way to draw lymph up from your extremities up back towards the thoracic cavity. Because just like air, it's under the influence, just like your lungs, it's under the influence of volume and pressure changes that influence airflow, except here it's influencing lymph flow. So we're saying that by breathing, you're actually able to draw lymph from your appendages up back towards your thoracic cavity because of the location of cisterna chyli, which is pretty cool. Now, cisterna chyli also receives lymph drainage from both lumbar trunks. So if you guys look closely here, we have the right and the left lumbar trunks, and these actually drain lymph from the right and left lower appendages, respectively, right? And so then after cisterna chyli, all of this is the thoracic duct. So if you work your way up, all this is thoracic duct, and it keeps going up, and then thoracic duct drains lymph on the left side. You guys see here? Right at the juncture of the left jugular vein and left subclavian vein, this is thoracic duct. But then thoracic duct also receives some additional drainage, not just from the lower extremities, but it also meets up with the left jugular trunk as well as the left subclavian trunk. And that's why the thoracic duct also drains lymph from the left side of your face and neck and the left upper appendage. Because if y'all remember, the left side of your face and neck are drained by this left jugular trunk, and the left upper appendage is drained by this left subclavian trunk, right? Makes sense. Over here, left upper appendage, left subclavian trunk. Now, it also receives drainage from the left bronchiomediastinal trunk, which means that it drains lymph from the left lung, okay? That's important to know. Now, the reason why we care to know about the flow of lymph here is that if someone has a lot of edema in a certain body part, you can kind of get a decent idea of where the blockage might be, right? Like, what if you only had a blockage in the left jugular trunk? Like just in the left jugular trunk, not the rest of the thoracic duct, just this little part right here. Like where would the lymph back up into then? If you just blocked your left jugular trunk. Not the whole face, just the left side of your face and neck. So that you'd only get swelling on this left side if the left jugular trunk were blocked. Good. What if you blocked the left subclavian trunk? Just the left upper appendage, right? Not the left side of your face and neck. What if you blocked the thoracic duct right where it drains? Like what if there was a tumor that was impinging right there? Where would the lymph back up? Yeah, good. Left side of your face and neck, your entire abdomen, and Both lower appendages. Very good. Awesome. So a lot, right? So it's kind of interesting. And so we'll talk about, though, what can lead to these blockages later. But here's the thing, too, guys, about lymph, is that it's actually a pretty low-pressure system. And so lymph is propelled through a variety of mechanisms because it's not like blood flow where it flows from high pressure to low pressure because there's no heart for lymph, right? There's not like a little heart in the lymphatic vessels that are like pumping lymph along. There's something that kind of functions like that, but it's not as strong as your heart to pump blood, right? So you might wonder, okay, well, if there's no heart to keep lymph pressure high, to move that lymph around, how is lymph propelled, right? Like, how do you get lymph from your toes all the way back up towards the top of your thoracic cavity where it's drained, right? I mean, from your head and neck, that's easy because that's just gravity. You know, gravity's going to pull that lymph down back towards these vessels. But from your lower appendages all the way back up towards your superior thoracic wall, how's it getting up there? Well, that's what this slide here is showing you guys. For one, we have a respiratory pump. And so the respiratory pump works just like we talked about with airflow, except now it's lymph flow, right? So if you guys remember with the respiratory system, we said that with an expansion of the thoracic cage, you increase volume but decrease pressure, right? And that decrease in pressure now in the thoracic cavity allowed you to have air flow in because it's going from high pressure in the atmosphere to low pressure in your lungs. Now, what about lymph, though? Because there's also fluid in your body. So if you expand your thoracic cage, right, it decreases pressure, which also draws lymph up to that lower pressure. So the respiratory pump, by breathing, also helps bring lymph back up to your thoracic cage, which is pretty cool. That's the respiratory pump. Also skeletal muscle contraction, because some of your larger lymphatic vessels are right by muscles. So when you squeeze them, when you're using muscles, you're basically kind of squeezing on a lymphatic vessel nearby. But why doesn't lymph flow back down towards the feet? Like, what prevents lymph from flowing towards the feet if it's squeezed on? One-way valves, right? We have valves that prevent backflow. So if you're using your muscles, like leg muscles in your legs, and they're squeezing on these lymphatic vessels, you know, if you squeeze on something, you'd think it would kind of go in both directions, right? But it can only go one way because the valves prevent backflow. So that by using your muscles and squeezing on those lymphatic vessels, it actually can kind of force that fluid up into each subsequent chamber, you know, up towards your heart. And then we also have pulsations of nearby arteries. And it's kind of like the muscular activity, guys. However, what you typically find are the larger lymphatics are right by your larger arteries that have big pulsations, right? And you can feel this, right? Like you can get like your radial pulse, you can get like a carotid pulse, and you can feel that kind of pulsation, right? Well, imagine if these arteries are pulsing and you have a lymphatic vessel right next to it, right? And lymphatic vessels don't pulse. But it's basically going to kind of squeeze on the lymphatic vessel, right? Because it's getting pulsed on. Now, when it gets squeezed on by the pulsation, where's that lymph going to go? Up with the valves, right? Not against them, but with the valves, because the pulsations of those nearby arteries are kind of squeezing on those lymphatics, which is kind of cool. So by even having a pulse, that allows for your lymph to move that way, which is pretty cool. So we also have peristaltic contractions, though. So there's smooth muscle in the wall of these larger lymphatic vessels, and it can actually do peristalsis. Remember those ungular movements we saw in the digestive tract? Okay, you actually can do that as well with your larger lymphatics. You have waves of smooth muscle contraction that can kind of squeeze that lymph up, kind of coaxes it up, and it moves kind of slowly. So it moves way more slowly than blood, right? Because your cardiac output at rest, like how much blood your heart can pump out at rest, ends up being about your entire blood volume, like 5 liters of blood. But it takes all day to return 3 liters of lymph back into your blood, right? So if you can compare lymphatic flow versus blood flow, it's way slower. Like you're saying, you're talking about far less than 1% of the flow of blood in your body, okay? It's probably a fraction of a point of a percent, right? And so in terms of the rate of flow. So it's flowing much more slowly, but because it's a low pressure system. Now remember though, we did talk about that lymphatic transport also is involved with there's an immune function here too. Because as lymph is transported, it's cleaned up along the way. But that takes time. So would you want to have really fast lymph flow if you're trying to clean up that lymph? No, exactly. It's like that classic skit. You guys ever saw that back in the day? I didn't really watch it a whole lot. Dang it, what's that show? Never mind, forget it. I can't remember the name of the show. Let's just move on. I can't give you the example because I have the image in my head, but I don't have the words to describe it. So let's move on. So what about the lymphocytes? Well, as the name implies, they're in lymph, right? Lymphocytes, they're lymph cells. So if y'all remember, we have T cells and B cells. T cells are the lymphocytes that are involved with either managing the immune response or directly attacking infected cells. And then B cells release antibodies. And so these ones are involved with humoral immunity. And these B cells would be the ones that would like produce, like maybe say, anti-A antibodies if you have type B blood, that kind of stuff. But they're also producing antibodies against foreign microorganisms, debris, toxins, that kind of stuff. And so if you guys look here inside of a lymph node, we actually have this reticular network of fibers, and there's all these lymphocytes and macrophages hanging out, and they're basically monitoring the fluid as it flows through, right? So as the fluid's flowing through a lymph node, these lymphocytes are just kind of hanging out there and checking it. And if it identifies something that shouldn't belong, like a microbe, they basically mount an immune response against that, right? This is why you could know if you have an infection if your lymph nodes are swollen, right? So you think about, okay, well, if your cervical lymph nodes are swollen, you probably have an infection somewhere in the head and neck because as that lymph with the bacteria or virus or whatever, as it's flowing down, encounters those lymph nodes, the lymph nodes can start to mount an immune response because they have immune cells there. That leads to inflammation, which can lead to swollen and tender lymph nodes, which we call lymphadenopathy, right? But that also happens with cancer too, because often your immune system can identify cancer cells, and it can also mount an immune response with that as well. So it's kind of interesting. So lymphoid tissue is basically like diffuse collections of lots of lymphocytes, and some examples of this would be like lymph nodes, right? Other examples of lymphoid tissue could be things like your tonsils, your vermiform appendix. If y'all remember the Peyer's patches of your small intestine, that's all lymphoid tissue. Your spleen's lymphoid tissue as well. And so the purpose of this is that it's got lots of germinal centers. Now, germinal means to create, like to germinate, germinal, right? And so germinal centers you find in these lymphoid tissues, and they can produce new B cells and macrophages. So what we're saying here, guys, is that all throughout your body, especially mucous membranes, you have lymphoid tissue that can make new immune cells if you're exposed to like a foreign antigen, like a microbe or a toxin or something like that, okay? So if we look at collections of lymph nodes around the body and look at this picture here, you guys, where do you see a lot of lymph nodes? Like, where do you see high collections of lymph nodes here in the body? Yeah, definitely in the neck. We call these cervical nodes. Very good. Axillary nodes right here, so in the armpits. Good. Inguinal nodes right here, kind of in the groin. Awesome. There's also a lot of abdominal nodes right here too, right? These ones are more difficult to palpate though because they're like sort of in between your abdominal organs and behind your abdominal organs. So it's more difficult to go, hey, yeah, my abdominal lymph nodes are swollen, you know. But you could definitely feel cervical, axillary, inguinal, right? So it's kind of interesting. And personally, I've had some swollen lymph nodes before, you know, not just from like having a head cold, but there's one time I got something called hot tub folliculitis. You guys ever heard of this before? You don't want it. Trust me, it's nasty. So what happens is that in hot tubs that aren't like really clean, there's a certain bacteria that can proliferate called Pseudomonas aeruginosa, and it's flagellated, which means it can wiggle. And this bacteria can actually wiggle into your hair follicles, and it sets up shop inside your hair follicles, and it starts feeding on your sebum and that kind of stuff. And you basically get, it looks like little pimples, right? So you get all these little pimples everywhere there's a hair, right? Because there's a bacteria in there, kind of like a pimple. And in fact, sometimes pimples are made of that same bacteria, which is interesting. But you get this from like dirty hot tub water. I know, so nasty, you guys, so nasty. But yeah, what I had though is I had like some really tender inguinal nodes because I had hot tub folliculitis, like, you know, on my lower appendages. So good times, not really. I haven't really been in hot tubs since then, you guys. It just kind of grossed me out generally. And the scary thing about it, you guys, it wasn't like it looked dirty. I'm like, oh, that looks like a dirty hot tub. It wasn't like it smelled bad. You know what I mean? Like there was no way for me to know that it wasn't like unclean, or that it was unclean rather. So, but you know, I don't know. Let's move on. So in terms of functions of lymph nodes, they filter lymph, right? So the macrophages help destroy that debris, and the lymphocytes can get other immune cells excited if an infection is present. And so the structure of a lymph node is kind of interesting because it's kind of like a big room, right? Where these large vessels can drain into the lymph node, and they bring lymph into this big space. You might think of it like a big old circus of immune cells, right? So as the lymph enters this space, it kind of swirls around in the trabecula of this node. And the trabecula means kind of a honeycomb-like network. And all throughout the trabecula, you find these immune cells that are just kind of hanging out and monitoring the lymph as it swirls through, right? Now, the lymph flows through the lymph nodes more slowly because it's a large space. So you have narrow vessels that kind of drain into a large space. So it kind of pools temporarily in the lymph node. And then what we have in the node are the cortex and medulla. The cortex has your germinal centers for B cells and macrophages. The medulla's got more of the trabecula where the lymph would actually swirl through. So if you guys look here at a cross-section of a lymph node, this is showing the afferent lymphatic vessels. So these are the vessels that would actually bring lymph to the node. So remember, if you guys remember from A&P1, we said that afferent information in the nervous system was bringing information to the central nervous system. That was like sensory information. Efferent was away from, like motor. And so the usage of those words here refers to lymphatic vessels bringing lymph to the node are afferent, and lymphatic vessels bringing lymph away from the node are efferent, right? Because it refers to the direction of the flow. But what I think is kind of interesting here, guys, is look how we have 5 afferent vessels, but only 2 efferent vessels. And if you think about this in terms of like lanes of traffic, like what if you have a 5-lane freeway go down to 2 lanes? What's going to happen? Traffic jam, congestion. But you guys see where the congestion is going to happen? In the node. Why would you want that? Why would you want congestion of lymph in a node? There's time for lymph to slow down. It pools in the node, and you're right. The immune cells have a chance to clean up that lymph. So it makes sense you'd want to have some congestion of lymph flow in the node because you can slow it down and allow time for all these immune cells to really monitor and maintain it and clean it up if there's something there, right? Now, if you guys look here, on the cortex, we have germinal centers, and that's going to contain your B cells and macrophages. And then in the medulla here, we have a lot of the trabecula, which basically has these sinuses or spaces that are full of lymphocytes and macrophages that can help clean up that lymph. So it's pretty awesome. Now, lymph nodes can vary quite a bit in size, you guys. You can say that some of your smaller lymph nodes are basically just several millimeters wide, so very, very, very tiny. But some of your larger lymph nodes can be up to 1 inch in diameter, right? So 1 inch for something that, like a node is pretty big because that's something you can easily palpate because it's large enough to feel, right? Now, these things can get bigger or smaller depending if there's inflammation present, right? So if a lymph node is inflamed because of an infection, what you'll find then is they're easier to palpate or touch, like on your neck or elsewhere. I know for me, one time I had a swollen lymph node somewhere on the side of my face, and I was really worried though because it was like a really deep pimple, you know, it was when I was a teenager. I probably had an infection somewhere just on that side of my face, like an ear infection or somewhere else. And it was like a big old lymph node swollen right here on my cheek, right? I thought it was a big cyst. And I knew about those kinds of things because my dad's in medicine. He would like talk about this stuff with me. So I started getting all worried, like, oh man, hopefully it's not a carbuncle, you know, like, because those things can get gigantic and they dangle down off your face and stuff. But it probably just was a lymph node, you know. So what this shows here, you guys, is some lymphoid tissue. Everything in gold is lymphoid tissue. So we see tonsils are lymphoid tissue. We'll talk about the function of those here pretty soon. Your thymus is lymphoid tissue as well. So is your spleen, Peyer's patches, and appendix. Now what this means to be a lymphoid tissue, it means it has a lot of lymphocytes in it, and there's specialized tissues and organs that can participate in the immune response. And many of these have germinal centers to make new B cells and macrophages, or even T cells. Okay? So let's talk about the spleen first. So the spleen you find in the left upper quadrant. You only have one, and it's your largest lymphoid organ. If I can give you guys an example of how big the spleen is, it's about the size of like a large avocado, right? Not a small avocado, because you can kind of just fit those in your hand. Like a larger avocado, like, yay big, So a fairly large structure right here on the side, okay? It serves a lot of the same functions as your liver in terms of breaking down like damaged red blood cells and that kind of stuff. But what we find in the spleen, you guys, is that there are some germinal centers. So you can actually have proliferation of lymphocytes. You can actually make new white blood cells here, or lymphocytes rather, inside the spleen. But it also cleanses your blood of like aged platelets and red blood cells. And it does this by having these small little spaces where these cells have to squeeze through. And if they're already kind of weak, they'll just tear open and rip open. And the spleen can just kind of remove that debris from the blood. So this is what the spleen looks like. And this is on a cadaver. That's why it kind of looks kind of grayish and there's not a lot of blood here. In a living individual, you guys, the tissues are much more bright. There's a lot more color to like abdominal organs. You can just tell this is a cadaver because it looks kind of grayish, if that makes sense. But what's kind of interesting is that back in the day when I used to teach cadaver lab, where like students were tested on the cadaver, rather, one of the ways you can identify the splenic artery is it actually forms kind of a curlicue. It sometimes can look like an S, as if to say like, hey, I'm the splenic artery going to the spleen. You guys see that here? Right there. The splenic artery. And it's serving the spleen. And so look how big that artery is too, guys. I mean, we're saying that the splenic artery is gigantic. So the spleen gets a lot of blood flow. And that makes sense as an organ that cleanses blood. You want to send a lot of blood flow there. And so other functions of the spleen, you guys, also are to store red blood cells and platelets for later use. So that if you like maybe lose some red blood cells or lose platelets because of a wound, then your spleen can actually release some extra red blood cells and platelets in your bloodstream to kind of replenish these lost formed elements, right? Now, it also can store some monocytes, or basically macrophages. But what's also kind of interesting too, guys, remember going back to AMP1, and we talked about how in red bone marrow, that's where blood cells come from, right? But what about when you're a fetus? Like, do your bones develop right away when you're a fetus? No, remember how like your bones actually start out as cartilage before they become bone? And so you don't find marrow in the cartilage. So what happens then is that during fetal development, red blood cells have to come from somewhere else because you don't have red bone marrow because there's no bones present yet, right? And so what we're saying then is that in fetal development, it's very likely, there's a lot of evidence to support this, that both the liver and the spleen, so your spleen and liver, are the sites of erythropoiesis in fetal development. And there's some evidence that this can continue even into adulthood. So some of your new red blood cells as an adult come from your liver and your spleen because they're sensitive to erythropoietin and they can make new red blood cells based on that hormone, which is pretty cool. So now it contains some lymphocytes, macrophages, and erythrocytes. But the function of your lymphocytes and macrophages is to cleanse that blood and lymph as well. And so the way this works, you guys, is we have white pulp and red pulp. The white pulp has a lot of lymphocytes, and it's involved mostly with immune functions like cleaning out lymph and blood. Okay? The red pulp has these large venous sinuses, and this is where blood is basically stored. Like you can store red blood cells and platelets in the red pulp. So what this looks like here, you guys, if you took a cross section of the spleen, is around the arteries in white. This is going to be large collections of lymphocytes and macrophages, and their immune function is to basically clean out blood and lymph. And then all of these guys are the venous sinuses here associated with your veins, and this is what's going to store your red blood cells and platelets. Now, knowing that the spleen is a highly vascularized organ, you can know why clinically we're really worried like if someone ruptures their spleen, because it has a lot of blood vessels, which means you're going to bleed a lot, right? And so if you get hit in the back there on the left side, like in the left upper quadrant, it's likely that you could potentially bruise your spleen, or if it's severe enough, if you lacerate the spleen, you're going to bleed out pretty quickly. That's going to require surgery. So when I was in high school playing football, someone got hit so hard that it did lacerate their spleen, and they had to go get an emergency splenectomy. I know, good times. Glad it wasn't me. So the thymus, we talked about the thymus already, right? So the thymus, not today, but earlier, this is something that you find in the mediastinal cavity. So that we talked about in AMP1. It's the site of T cell maturation. So your T cells mature in the thymus. And it also is mostly active before puberty, right? after puberty, the thymus starts to begin to disappear. Now, it never really fully disappears, but you lose about 5 grams of thymus every year after puberty. So you're saying that after like 60 years following puberty, so maybe like you're 75 or whatever age that would be, what you find is there's not a whole lot of thymus left. One of the main functions of your thymus, though, is for T cell maturation, and it begins to atrophy after puberty. So we're saying to you guys that after puberty, you become slowly more and more immunosuppressed because it becomes more and more difficult to mature new T cells. This is why we're saying that elderly individuals are at a higher risk for infectious diseases, right? It also explains why very young people are at a higher risk for infectious diseases too, because their immune systems haven't developed yet. So it's two different problems. So very young people are immunosuppressed because they don't have developed immune systems, and elderly are immunosuppressed because their immune systems have difficulty developing because of the atrophy and loss of the thymus and other lymphoid tissues as you get older, okay? So the tonsils also play an immune function. And I think the tonsils are probably one of the most interesting of the lymphoid tissues because they kind of have some unexpected functions here. Now, what happens is your tonsils are lymphoid tissue, which means they contain lots of germinal centers. But the tonsils are also highly folded, right? And so when the tonsillar tissue folds in on itself, it forms these big infoldings called the tonsillar crypts, okay? I think that sounds kind of cool, like the tonsillar crypt, okay? And so you might say like the crypt keepers of the tonsils would be like your lymphocytes, right? They're deep in the crypt, and they're just kind of monitoring what might fall into that sort of cavity, right? And so it kind of makes sense, though, in terms of where you find your tonsils. You find your pharyngeal tonsils in the back of the nasal cavity. You find your palatine tonsils and your lingual tonsil in the oropharynx, just in the back of your mouth. So what we're saying here, you guys, is there's some tissues at the entry point of your respiratory system and your digestive system that have these deep infoldings that can trap debris. So what's interesting here is then if you inhale infectious microorganisms, or if you swallow some bacteria or viruses, some of that is going to get trapped in these tonsillar crypts. And so then what these immune cells can do is not only destroy that bacteria, but also begin to mount an immune response against them because they're seeing it first, right? So even before that air gets deep into your lungs, some of these immune cells can be monitoring, the environment of the air that you're inhaling because it's trapping some of that in the nasopharynx, right? In the pharyngeal tonsil. Or even before, that rotten food that maybe you ate, like, okay, yeah, it's only 2 days past its expiration date. It's still good, right? Maybe it's not good. I eat a lot of food I hear about more recently, you guys, that's being recalled as like hummus. And I eat a lot of, and I care about that because I eat a lot of hummus, you guys, like a tremendous amount, probably more than it's healthy, And so there's something about hummus that there's a lot of bacteria in there or something, okay? And so I always get kind of freaked out. I'm like, oh man, it's been a week since I've opened this thing. Like, is it still good? I don't even know. Like, it doesn't smell bad, But let's say if it weren't good. Let's say if I did get a big old chip full of this kind of rotten hummus. I eat it and I swallow it. Even before that rotten hummus gets down to my small intestine, what happened in my oral cavity? My tonsils trap pieces of that hummus in the crypts, right? Specifically the lingual tonsil and my pharyngeal tonsils, right? And then those lymphocytes that are present can already begin to mount an immune response against that rotten hummus even before it gets to my small intestine. So what that does then is it improves the speed and the efficiency of my immune response. And so I actually might not get sick from that. So if I can mount a response quickly enough, you can avoid illness, which is pretty cool. But what does this mean if you had tonsillectomy? You're going to be slightly immunosuppressed. You got it. Very good. Because and it might not be enough to lead to death or disease, but you're just not going to have that sort of immediate feedback about whether you're inhaling or swallowing things that are potentially infectious. So what this looks like here, you guys, remember we have pharyngeal, palatine, and lingual tonsils, and here's that tonsillar crypt going down deep. So imagine that you breathe in some air, some bacteria get trapped in here, and all along the way we have immune cells in these germinal centers that can monitor what's in those crypts. Here's the problem, though, you guys, is that sometimes you can get so much inflammation of the tonsils, it can cut off your airway or cut off, the rest of your oral pharynx, and that can be life-threatening. In fact, one of the ways you can determine like how much inflammation there is going on is you can quantify how big the tonsils are. Like if the tonsils touch each other in the back of the throat, they're +3, right? So you're saying if your tonsils on either side of your oropharynx are actually touching, right? Instead of being flush with the wall of the pharynx, imagine they're so close together and they're so swollen, they're now touching. You have a huge obstruction in your oral cavity. It's gonna be difficult to swallow food, and it's gonna be difficult to breathe. And that's where if you're like threatening someone's ability to ingest or ventilate, then you might want to remove those tonsils. And that's when someone would get a tonsillectomy. Now, people also can get tonsil stones, which is basically when debris gets stuck in these crypts and it's not adequately removed, and that thing leads to chronic irritation of the tonsils, which can lead to inflammation and further complications. It's kind of interesting. All right, guys, so we also have mucosal-associated lymphoid tissue, or MALT. And so this stuff you find along all the mucous membranes of your body, like your respiratory tract, your genitourinary tract, and even your digestive tract. The MALT that we talked about along the digestive tract, though, was the Peyer's patches and your vermiform appendix. We've talked about those ones, right? So Peyer's patches were found in the ileum, and the appendix was found on the cecum. And what those do is that, like the rest of this lymphoid tissue, is they monitor the bacterial environment. They have germinal centers, and they can mount an immune response if there's an infection present. Okay? So remember the Peyer's patches you found in the small intestine, very similar to the appendix. And the appendix also has a very similar function in terms of kind of storing cells to have a memory of infection, right? One of the functions of your appendix too, guys, is to store the good bacteria for your gut. So going back to the digestive system, do you guys remember how is it that we have good bacteria? What does that mean, to have good bacteria? They're bacterial flora, which are the good bacteria, but what makes them so good?
So they can help repopulate if something happens with the rest of the tract.
Yeah, I mean, they can repopulate your gut if something bad happens, right? Like let's say if the flora kind of go out of whack and you have pathogenic bacteria, your appendix can store the good bacteria and they can repopulate. But what makes those good bacteria so good? Like, why are they good for you? They're bacteria. Like, don't you think they want to kill you? Yeah. They allow digestion, right? So they actually can help ferment indigestible carbohydrates. They also make certain vitamins for us. You guys remember what vitamins come from the bacteria of our gut? K, good, and B complex vitamins, nice. But they also outcompete bad bacteria. Like by having good bacteria already set up shop in your colon, then it prevents the pathogenic bacteria from like getting a foothold and causing disease. So very good. So if we look at what this would appear like, you guys, in the small intestine, this is the lumen, and you can see all throughout the submucosa here, these are Peyer's patches, which are huge centers of germinal centers of B cells and macrophages. And the purpose of having all these, you guys, is that, and this is kind of weird, is that 70% of your immune system is localized to your gut. And the reason being is that there's so many bacteria there in the gut that you have to have that many immune cells present. And that's why you see so many of these Peyer's patches present in the small intestine because, again, 70% of your immune system is in your gut.